Hello and welcome. In this video, we're going to explore one the largest, strong, and most complex joints in the human body, the knee. We'll take a look at its bones, ligament, muscle, cartilage, blood vessels, and nerve, and how all of these components work together to help us walk, run, jump, and simply stand upright. Let's begin with the bones. The knee connects three main bones, the femur, tibia, and fibula. The patella, or kneecap, also plays an important role. At the distal end of the femur, we find two prominences, the lateral condyle and medial condyle, separated by the intercondylar notch. Above them are the epicondyles, lateral and medial, and on the medial side is the adductor tubercle. The tibia, the large bone in the lower leg, also has medial and lateral condyle, a broad surface between the ankle the intercallar area, and prominent bone on the front calf of the tibial tuberosi, which is the intersection point for the quadriceps tendon. The fibula sits laterally, it has articulated with the tibia, and serves as an attachment point for key ligaments. This fibula. Finally, the patella is a sesamoid bone embedded in the quadriceps tendon. It protects the front of the joint and helps with efficient knee extension. This patella. The knee is far more than just a hang inside. It contains several key components. The menisci are crescent-shaped cartilage structure that sit between the femur and tibia. The medial meniscus is C-shaped, while the lateral meniscus is more circular, but help distribute pressure and stabilize the joint. The ligaments keep the bones aligned. The cruciate ligaments, anterior and posterior, prevent the femur from sliding too far forward or backward on tibia. The collateral ligaments, medial and lateral, prevent a side-to-side movement. The joint capsule surrounds the knee, protecting it and contains synovial fluid which lubricates the joint. Articular capsule. The patella and quadriceps tendon, along with the patellar ligament, form the front of the joint support strut. The main movements at the knee are flexion and extension. Now the muscles. The powerful quadriceps femorus in the main extensor, it has four parts: vastus lateral, vastus medial, and rectus femoris. Behind of the rectus femoris, we see vastus intermedius. These muscles join together in the quadriceps tendon, which insert into the tibia via the patella. These muscles allow us to strengthen the leg, stay upright, walk, run, and jump. For flexion, the most important muscles are the hamstring, semitendinosus, semimembranosus, and biceps femoris. Other muscles that assist in deflection include sartorius and gracilis. Sartorius and gracilis. Additional muscles at the back of the knee include popliteus, which helps unlock the knee at the start of flexion, gastrocnemius, which primarily act at the ankle but assists with knee flexion, and plantaris, a small vestigial muscle. This area also contains important arteries and nerves. The femoral artery runs down the front of the thigh, and once it's passed through the adductor hiatus, it's become the popliteal artery. At the back of the knee, from there, it gives off branches called genicular artery, superior and inferior, and medial and lateral, which supply the joint. And finally, innervation. The sciatic nerve, as it reaches the knee, divides into the tibial nerve, which travels between the heads of the gastrocnemius, and the common peroneal nerve, which wraps around the knee of the fibula and continues into the lateral leg. This nerve controls the muscle in the back of the knee as well as part of the lower leg and foot. As we have seen, the knee is a highly complex joint designed to combine strength, stability, and flexibility. Thanks to its architecture, we can move fluidly to everyday and athletic activities, understand its anatomy is key to recognizing how injuries happen and how to prevent them.